Hello there, this is Dr. Emma Foraker. Today I want to talk about the two different techniques that you can use to inject lip filler. Now, there's actually much more than just two different ways of injecting lip filler, but I think that when you're starting out, you really should be using what I'm going to call the horizontal thread lip technique, which is kind of the basic lip filler technique that was originally created. And then as you become more advanced, you can integrate different ways of injecting lip filler together. And in a lot of ways, you're going to combine different techniques into the same procedure. So at this point, there are some times when I would just use the horizontal lip filler technique. For example, if it's the first time somebody's getting lip filler, if their lips are very thin. But in a lot of cases, when it's not their first time ever getting lip filler, they have some volume, but they want more of an everted appearance to their upper lip, for example, then I will combine both the horizontal lip filler technique with the vertical lip filler technique, also known as sometimes the Russian lip technique. There's the tenting technique. Those are all kind of similar names for the same technique. But I've also heard of many different other trademarked names, the Swedish lip technique. But today, for the sake of simplicity, we're talking about these two kind of basic variations of lip filler technique. So like I said, the first and foremost lip filler technique is going to be your horizontal thread technique. So in this technique, what you're doing is you're simply doing what it's called horizontal threads of lip filler, and you're going to start at one edge of the, around the vermilion border to first add these threads of filler around just the border, and then later you'll go back in and fill the body of the lips. So I would say, using a 30 gauge 1/2 inch needle, let's say, you're gonna have maybe 2 threads on the border over here, 2 threads on the border over here. And when you inject, you're injecting the needle along the border, and then as you pull out, that is when you're injecting the actual product. On the bottom here, you might have 4, let's say, different threads of filler. 1, 2, 3, and 4. Obviously, you'd be coming from this side if you're injecting the patient. And once you've completed outlining the lips with horizontal threads of filler, then you're going to fill the body of the lip. So similar idea, you're going into the lip here, 1 thread, 2 threads, 3 threads, 4 threads. Bottom, 1 thread, 2 thread, 3 thread, 4 thread. Now, keep in mind that, usually when you're doing lip filler, you're going to be using about 1/2 syringe to a full syringe of filler. But I think that in a lot of cases, it's a good idea to start with as little as possible to ensure that the patient likes it. When I first got lip filler, I was glad to have only gotten 1/2 syringe because my lips swelled like crazy, and I was a little bit shocked that night about what my future lips were going to look like. But and so by just doing the horizontal threading technique, a 1/2 syringe of filler will go quite far. But again, like we talked about, taking it to the next level, let's quickly touch on how you would perform then some vertical threads in order to create some more E version of the lip, which is a very popular look these days, where our upper lip is about half of the width between our upper and lower lips, whereas before in nature, usually our top lip is about 1/3 and our bottom lip is about 2/3. We in our society today love a good filled upper lip. So what we're going to do in this case is we're going to go inside of the vermilion border. What I want to point out is that even when I was doing my horizontal threads, I never injected into the white lip. I'm within the vermilion border of the red lip. So that's a very important thing, because what we do not want is migration of the filler and creating that ducky appearance where people have, a filler mustache, so to speak. So the vertical lip technique is where you're injecting at this angle and you're doing little vertical threads. Now you can do it from the same hole and do kind of a fanning where you're doing multiple threads from the same hole, or you can just kind of quickly. Well, it doesn't have to be quickly, but, doing 1 thread, 2 thread, and just all along. I really never recommend filling anything right in, between the Cupid's bow. That can create this weird, too much volume in the middle of your lip. So I really do recommend only filling beyond this kind of middle area. But regardless, little vertical threads. And you'll see as you're doing that, you're going to see that lip really evert. All of these injections are very superficial. The important arteries, the superficial labial artery and the superior labial artery and the inferior labial artery are both deep within the lips. And so by keeping your injection points very superficial, almost to the point where you can see your needle as you're doing your injections in either different technique, you're going to be able to avoid those arteries. So either way, whether you're doing those vertical technique, and then on the bottom here, same idea, you're going in and creating E version of the bottom lip, E version of the top lip. You're staying very superficial to avoid the arteries. So that's how I like to think about lip filler technique. If you have any questions, please let me know. But again, I want to just point out that in most cases, I'm going to be doing a combination of both of those techniques depending on what the patient is going for, what their concerns are. If they've already had lip filler in the past and we are just touching it up, I might just do the vertical tenting technique. So it just depends. Sometimes I'm not even touching the bottom lip and I'm only adding volume to the top lip, for example. So it's all going to be a case-by-case basis, but just want to talk about, the basics of lip filler technique. And if you have any questions, again, please let me know, reach out to me. Thank you. Have a good day.